Today I'm going to present the mental health status among the primary caregivers of cancer patients in Bangladesh. So you know that cancer is a major global health problem with higher levels of physical and mental health burden on the patients, their families, and the healthcare system as well. So the incidence of cancer has been increasing rapidly in Bangladesh, with many patients presenting at later stages of the disease. However, the mental health status of the primary caregivers of cancer patients is yet to be explored. We aim to assess the mental health status of the primary caregivers of cancer patients in a tertiary cancer care facility in Bangladesh. So here are some facts and figures that the number at a glance. So you can see the number of new cases is near about 156,775 patients, and number of deaths is near about 1 lakh. And if we see the number of new cases in both sexes, these are the, it's 156,000 near about, and esophagus, lip, oral cancer, breast cancer, and lung cancer is the highest. If we consider the new cases in males and females, you see there is 88,000 males and 68,700 females. So what are the drawbacks in cancer treatment in Bangladesh? Definitely we have fewer cancer care facilities in public sector, and most of the expenditures are out of the pocket of the patient. That is very difficult for many patients of our country. And you know that cancer treatment is quite complex and expensive, and the long duration of treatment sometimes fatigue the patient, the family. The mental health aspect of cancer is rarely addressed in a poor country like ours. So what are our objectives? Our general objective was to assess the mental health status among the primary caregivers of cancer patients at a tertiary cancer center in Bangladesh. And our specific objectives were to assess the mental health status, to find out the extent of mental health problem among the primary caregivers, to determine the contributing factors behind the mental health problems of the caregivers, and to find out the socio-demographic pattern of the caregivers. It was a prospective study, and the study population were primary caregivers of admitted patients at the National Institute of Cancer Research and Hospital Bangladesh, which is the only comprehensive tertiary cancer center in public sector of Bangladesh. And the sampling method was convenient sampling, and sample size was 290 caregivers, irrespective of age and sex. We used two different tools. One is the DAS-21 scale, which is depression, anxiety, and stress scale, 21 items. And we also used a Zarit Bardin interview scale. So the proportion of participants who had emotional states of depression, anxiety, and stress were estimated, and their correlates examined using logistic regression to yield adjusted odds ratio with 95% confidence interval in Stata 16. The characteristics of the study population. I mentioned earlier the total number of participants were 290. Among them, 59% were female and 41% of male. That means that female are the higher rate caregivers. The age group, less than 30 years, 80, that is 27%, and mostly the caregivers are above 30. The educational status, 41% had secondary or higher education, but 25% had no education. And you see, 44% were housewife, that means they didn't have any official work, and 71, that is 24.7%, were unemployed. The caregiving characteristics. What is the relationship with the cancer patients? We found that parents and spouse are the caregivers most to the cancer patient. And most of the patients were in advanced stage, which is 69.3, near about 70%. What is the duration of cancer diagnosis in months? it was 9 months. So after 9 months of diagnosis, they came for treatment in a cancer care facilities. And the treatment cost, the median treatment cost in US dollar, it is near about 1,800 per patient, which is quite alarming. Before coming to a government facility, they have spent such amount of money. And what is the duration of caregiving? The median duration was 7 months. The caregiving responsibility, sole responsibility were 54%, shared responsibility 46%. The type of treatment they took, like chemotherapy, radiotherapy, combination, and surgery. This is the distribution of negative emotional states of depression, anxiety, and stress among family caregivers of cancer patients according to DAS-21 scale. So, distribution of caregiving burden according to Zerit burden scale. You see, most of the patient caregivers had mild to moderate burden and moderate to severe burden of anxiety, stress. Now, the relationship with the cancer patients, we found that it was not significant, but stage of cancer had significant association between emotional state of depression and caregiving. The duration of cancer diagnosis, it was also significant. If the diagnosis were 6 months or more, then there was significant depression. The cancer treatment cost also were significant. So we found that if the treatment cost was more than 1,000 US dollar, then it is significant cause of depression to the caregivers. And type of treatment received was not significant. Duration of caregiving is also very much significant. The OR, adjusted OR was 2.60. If the duration of caregiving were more than 6 months, then the depression was more. And caregiving burden based on Zerit burden, it was highly significant. That means mild or moderate burden caused them depression. Association of anxiety with various caregiving characteristics. Most of those were not that significant, so I just pass it. But the caregiving burden based on Zerit burden were significant for anxiety as well. So mild to moderate burden and moderate to severe burden were significantly associated with anxiety state of the caregivers. Association of stress with various caregiving characteristics. Here also, we found that duration of cancer diagnosis of 6 months or more were significantly associated with anxiety state. Duration of caregiving more than 6 months or more were significantly associated with anxiety. And also, Zerit burden score was significantly associated with anxiety. So in conclusion, we can tell that among 290 caregivers included in the study, severe or extremely severe levels of depression, anxiety, and stress were found in 17.9%, 29%, and 13.1% respectively. Advanced stage of cancer was significantly associated with depression among the caregivers, but not with anxiety and stress. Those who were caring for cancer patients more than 6 months had higher odds of depression and stress. There was no significant association between depression, anxiety, or stress with relationship of the caregiver, treatment cost, type of the treatment received by the cancer patient, or caregiving responsibility. So I had some recommendations, but I couldn't show it. Okay. So, recommendation, psychiatric support at all cancer care facilities, diagnose those who need support. We have to ensure better cancer care and financial support for cancer patients apart from government. So these are only some figures, but the true stories are not fully told of the sorrow, loss of job, selling of properties, and above all, dying of near and dear ones after a long suffering. Thank you very much.